Abnormally high or low hydrogen ion concentration, acidemia or alkalemia, respectively, is encountered relatively frequently, particularly in hospital-based practice. Okay, so if the hydrogen ion concentration in the blood is low, we call it acidemia. If the hydrogen ion concentration in the blood is high, we call it alkalemia. Okay, now acidemia may be caused by an underlying life-threatening condition, and several acid-base abnormalities can coexist in a single patient, and that is why you can have a mixed picture as well. Now, there are some causal conditions. We have what we call high anion gap metabolic acidosis, normal anion gap metabolic acidosis. And in the course of these lectures, maybe one of these days we'll also pick a time and really deal with these things. But for today, we are going to crunch how to break down what is metabolic acidosis, what is respiratory acidosis, just by looking at the figures. Okay, so the high anion gap metabolic acidosis, it can be from exogenous sources like methanol, like patients who are in ketoacidosis. Okay, and then you can also have normal anion gap metabolic acidosis. For example, somebody who has gastrointestinal bicarbonate loss, for example, diarrhea, right? And then patients with renal bicarbonate loss, like renal tubular acidosis and interstitial nephritis. So please, on this slide alone, this is very, very important. Causes of high anion gap metabolic acidosis, for example, methanol, ketoacidosis. Causes of normal anion gap metabolic acidosis, for example, diarrhea. For example, renal tubular acidosis. For example, interstitial nephritis. All right. Now, we also have metabolic alkalosis, and we have the expanded effective arterial blood volume, where maybe a patient has mineralocorticoid excess or contracted effective arterial blood volume, for example, from GIT loss. Remember that we have hydrochloric acid in the stomach. So if you have a patient who is having vomiting, losing the hydrochloric acid, then the patient may become alkalotic. And we also have renal losses like diuretics, okay, and exogenous ingestion. And then when it comes to respiratory acidosis, why will a patient develop respiratory acidosis? The causal condition can be neuromuscular causes. So a patient who is taking medications, illicit drugs, neuromuscular disease, and pulmonary causes of decreased alveolar ventilation. For example, severe asthma exacerbation with impending respiratory failure. And kyphoscoliosis and hypoventilation. These are all causes of respiratory acidosis.